Hello, I'm Cathy Roe, and this videotape is all about the basics of anatomy and kinesiology, especially for dance teachers. Now, I really want to stress the word basics. We're just going through the very basics of these sciences, because as you can imagine, people study these sciences for years. We're just going through the very basics, but I think when we're done, you'll agree that this will make you a much more educated and efficient teacher of dance, especially dance technique. Now let me tell you about the strategy we're going to use on this video. The first thing that we're going to do is go through all the basic vocabulary of anatomy, starting with the planes of the body. Then we'll go through all the basic vocabulary of kinesiology, and we'll talk about what that all means. From there, we're going to look at the skeleton, we'll name all the bones, and from there, we'll go on to muscles and name all the muscles. Now, after that is where things get really interesting for us as dance teachers, because we're going to go through the kinesiology of what makes the body move. What makes the body move are the bones as levers and all the muscles connecting to those levers that create the movement. So we'll go through all of the body, and we'll see what makes everything move so that we can determine what muscles are really necessary for a beautiful arabesque and what muscles are really not necessary. This way we can help our students work so efficiently. Let's get started with planes. This is the first thing we learn in basic anatomy. Planes are like big flat sheets that go through a body and divide it into equal parts or unequal parts. This is my demonstrator, Amanda Hill. Amanda will be the demonstrator for our whole videotape, starting here with planes. But the first thing Amanda is going to show us is anatomical position. Anatomical position is in parallel with the palms forward like this. Not a very dancerly position, but it is anatomical position. Let's talk about planes. When a plane, we'll say this is the plane, goes right through the middle of the body. Let's pretend it's going right through the middle of her body. This would be called the lateral plane. When it goes right through the middle this way, like I'm going across the top of her head, we would call that the sagittal plane. Now let's face front, Amanda. When the plane moves right through the body horizontally, we would call that the transverse plane. So that you can see, the plane divides the body. When it's coming through the top of the head this way, through the body, one more time, that would be the sagittal plane. When it comes through the body this way, all the way through and divides it in front and back pieces, again, that's the lateral plane. And coming this way across, it is called the transverse plane. So that's the way we divide the body. When the body is divided, when you're looking at the front, we're going to go through a little bit of vocabulary about directions. When we're looking at the front, that is called the anterior view. Turn sideways to the camera, Amanda. When we're looking at the side view, that is called the lateral view. And then to the back is called the posterior view. Let's face the front again. Now, there are so many terms. We're just using the very basics. In dance, we have this kind of directions, too. If you recall the 8 positions of épaulement, to the front, we would call that en avant or devant. But no, in science, anterior. To the side, we would call that à la seconde if she was going to put her arms to the side. But no, once again, lateral. And what we would call derrière, to the back, again, that's called posterior. Now, considering those planes, we can also consider movement along those planes. Now, Amanda, I just want you to stand with your arms in second position. So her arms are on the lateral plane. And take your stretch over to the side. So when we stretch side to side, now the other way, when we stretch side to side in this manner, we're said to be moving on the lateral plane. When we move forward and back, like we go to flat back and then come up and combre to the back, we are said to be moving on the sagittal plane. Let's take that stretch to this lateral and then go flat back on a twist, Amanda, and come around. She's coming around on a transverse plane. So why would we even want to know about these planes as dancers and dance teachers? Well, one of the very good reasons to know about these is when we are designing our warm-up and we are designing our dance exercises, we always want to be aware that we want to design movement on all of those planes, on the lateral plane, front and back on the sagittal plane, and on the transverse plane. Now in my warm-up, I start like this, and you can see that I have a big twist going on. Sometimes these twisted movements are also called movements on the transverse plane. So let's take a look at my warm-up, and I'll make an example of this for you. Here you can clearly see the beginning of my warm-up, and as I said, I start with a twist, which is sometimes called the transverse plane. I go into lateral movement, making a big circle around to the right and to the left. These are my opening stretches for lateral movement. Whenever we go forward and roll up, or go into cobra, which is a stretch to the back, we are doing sagittal movement. So whenever we design our warm-ups, we want to make sure that the torso, that is from the top of the head to the coccyx or the sit bones, gets a lateral, a sagittal, and a transverse stretch. Now let's go through some very basic terminology and vocabulary from our kinesiology. We're going to start out with a word called abduction. Abduction is whenever a movement goes away from the midline. So let's watch Amanda for a moment. She's going to go into en bas position. As she opens her arms to a la seconde, you can see that the limb travels away from the body. Therefore, it's abduction. Let's focus in on the legs and feet. We'll see Amanda do a tendu out to the a la seconde. Again, you can see that the movement was away from the body. That is abduction. Come on back to first, Amanda. Now, when we have movement that draws into the body, that's called adduction. So let's go on out to the side one more time. So when we have a dancer starting out in a la seconde and coming into en bas, you can see how the limbs go toward the body, so therefore adduction. Go back to your tendu, Amanda. When we have movement in toward the body from the hip, here we go, pulling that leg in. The leg came toward the body, so it is adduction. Now here's how I remember it. Go on out to your tendu and your a la seconde. When we have adduction, I think of adding into the body. So she's going to come in. See, the arms and legs are adding into the body. That's just how I remember it. So remember we had that sagittal plane going right through the middle here? That's also called the medial plane. So any movement, let's try one more time. You're in tendu and you're out. Any movement that comes into the medial plane is adduction. Away from the medial plane is abduction. The next thing we're going to talk about is flexion and extension. So I'm going to ask Amanda to go on out, and we're going to talk about her elbow. Now, we're going to flex and extend at the elbow joint, but let me tell you first, what is the definition of flexion? The definition of flexion is when you find the point of articulation, and then the bones of that point of articulation decrease in angle. Might as well be Chinese. Let's put it in English. An articulation is just a joint. So when we talk about a joint, and in this case the elbow joint, we're going to take this bone and this bone that make the joint, and you can see now we're like at 180, and we are going to decrease the angle. See, now we're at 90. And then decrease the angle, now we're at 45. See, the angle's getting smaller. So we know this is flexion of the elbow. Now, just by the same token, as the angle gets bigger, we have extension. So that would be elbow extension. So let's come on down to the front. We're going to talk about the shoulder joint. In the shoulder joint, we also have flexion and extension. When we just take the arm out straight, we have shoulder flexion. When the arm comes all the way back this way, we have shoulder extension. Now, extension and flexion is pretty easy at the shoulder. It gets a little more difficult at the hip. First, let's just look at the knee. So, we're coming down here. We have this bone and this bone. And remember, the articulation is right here at the knee because we're going to be talking about flexion and extension of the knee. We want to make the angle decrease for flexion. So come on up, Amanda, just bring your leg back. Here we have flexion of the knee, and when she straightens it out, extension of the knee. The hip's a little bit more difficult. Let's stand in a second with your arms, just give yourself a little, I'll be your human bar. So, turn out, Amanda, and we're going to, from the hip, just go to tendu in the front, take it to dégagé just off a little bit. You see we're coming to hip flexion, and come on back into first position. Now, the hardest thing to do at the hip is hip extension. So tendu onto the back, and as she lifts it up, you can see the angle is in the hip, increasing, and we have extension of the hip. Let's come back to tendu and close. Another word we always want to know about in our kinesiology is the word rotation. Now remember that plane that went right through the middle of the body, the medial plane? It's also called the sagittal plane. Well, we want to refer to it now as the medial plane, because when we come into tendu in the front, we're going to talk about the hip socket. We have rotation inward and we have rotation outward. When we have rotation inward in the hip, turning in, that would be called medial rotation. And when we turn out, we refer to that as lateral rotation. So come on in, Amanda. Good, and take your arms in a la seconde. We can also do it from the shoulder. When our shoulders roll in like this, we're coming toward the body, we have medial rotation. When they lift up into a bowl, we have lateral rotation. Now, you may have noticed that Amanda's been balancing on one leg a lot whenever she did her extension of the hip and flexion of the hip, and we expect our dancers to balance on one leg all the time. Now, there's one more term we want to talk about, and this is one of the most important. The word is stabilization. Because when we tendu to the front, go on to the front, this is the performing leg, performing the lateral rotation. But this leg has so much to do because it needs to stabilize. So we talk about hip stabilization. We'll be talking about the muscles necessary. When the arms go to the side, and let's say we're doing kicks across the floor or turns across the floor, we need the whole upper body to be stabilized. Now, what it means to be stabilized is the joint or the articulation does not move when other things move. So let's go into middle fifth, Amanda. So in middle fifth, you can see if she's doing a series of chaîné turns, she's going to really be stabilized in the shoulder joint and in the abdominal, so that when she's turning, she's not pulled off by the centrifugal force. And back to en bas. We only have a few more terms to learn, and these are terms from the posterior view. Amanda, can you turn around for us? We're going to look right here at the shoulder blades. The real name is the scapula. And we're going to look at the movement around the shoulders and the scapula. When you shrug up, this would be elevation. Pressing down is called depression. Let's put your arms in a la seconde for a moment. It's a little easier to see. When the shoulder blades come towards each other and you see this big line in the back, that is retraction, something we never really want to see at the ballet bar. And when you pull apart and get rid of that line and pull the scapula away from each other, that is protraction. Here we have our class mascot, Mr. Bones, who's going to help us go through all of the bones in the human body. Now, one thing that's very interesting about our skeletons is it's made up of 206 bones by the time we're 25 years old. Before that, when you're a baby, all of these bones, or many of these bones in the skull and other bones around, are separate, even in the pelvis. And as we grow up, they fuse together. So by the time you're 25 or 26 years old, you should have 206 bones. bones have 5 basic purposes for us as human beings. The first one is, as you can see in the rib cage, it forms a protective area for the organs on the inside, such as the heart and the lungs. The bones are also, as you can see, they create a framework for all the soft tissue to hang off of. Also, the bones are like a little factory. They make our red blood cells, and they're a storage house as they store many of our minerals, such as calcium. The properties of the bones and the skeleton that we are most concerned with as dance teachers is that, as you can see, they create many, many levers. And when muscles attach to these levers and contract and release, the levers start to move. So it's the system of levers that really is most interesting to us as dance teachers. Now, when we consider the skeleton, there are 2 types of skeletons that we refer to: the axial skeleton and the appendicular skeleton. The axial skeleton is like your basic part of your skeleton. The axial skeleton is the skull, the vertebrae, the rib cage, and the sternum. The appendicular skeleton is everything that kind of hangs off of the axial skeleton. So let's start off with the vertebrae. The vertebrae are just very, very interesting. As you can see, Mr. Bones is quite the sway back, very swayed in this example. So you can see that the top of the vertebrae come out on this angle, and the middle vertebrae slide out on this angle, and then we have another sway. So it makes an S, sort of. The reason for this marvelous and ingenious design is because the spine, when it has these curves in it, can absorb shock. So I know as dance teachers, we try to get that spine super straight, so straight, but really we don't want to tuck under the pelvis or take all of the curves out, because this is what we need to absorb the shock, especially for jumps. The spine is divided basically into 3 categories of vertebrae here. We have right on top the cervical vertebrae. There are 7 cervical vertebrae. The very top cervical vertebrae and number 2 cervical vertebrae are really special. The top one is called the atlas. And remember when we read literature, that strong guy named Atlas? Well, they call this one the atlas on top because it has to hold up the whole head. It has to be very strong. Right under the atlas is the axis, and this is why they're pretty special. If you think of the atlas, think of a donut. It's just like a round hole like this. The axis underneath is a round donut too, but it has like a spike on it. So it pokes right in there, and then we have this kind of movement where you can say no and yes. So no and yes, it's all about the atlas and the axis. Coming down, we have 7 in all, as I said, of these cervical vertebrae. The next vertebrae, the one that kind of comes out, you can't see it very well on Mr. Bones, but usually it comes out a little bit more, and when it comes out a lot, you see a humpback. We don't want to see that. These vertebrae, there are 12 of them, and they are called the thoracic vertebrae. Now, the thoracic vertebrae, what makes them special is you can see the posterior view. You can see the thoracic vertebrae are the vertebrae where the ribs start, and they come all the way around to the front. That's what's special about those. The lumbar vertebrae, there are 5 in all, are the vertebrae that have the most curve in them, and they'll absorb the most shock. Now, the lumbar vertebrae, as you can see, are the longest and have the longest little spines out here on them. Now, when we take a look at all of the vertebrae and we see all of these, what I'm going to call spines off of the back, you can see that if our students are going into cobra or doing a back bend, these little sticky outy spine things are all going to bump into each other. So one of the things we have to really realize about our students is every one of them has a different skeleton. These are different shapes and different sizes on everybody. So we might see one of our students being able to do a perfect back bend at all times, and another one of our students might have so much trouble going into any kind of spinal extension because these things kind of bump into each other and inhibit movement. So one of the reasons to study anatomy, I think, is to really get it through our heads that everybody, every student is so different, and every skeleton has its limitations that are unique to every single person. So we can't expect our students to all be able to do the exact same kind of back bend, you know what I mean? And when we study anatomy, we start to see how different everybody really can be and how we have to know about the limitations of bone and muscle in order to be the most effective and educated teachers that we can be. When we get down to here, we see an area called the sacrum. Now the sacrum is 5 vertebrae that are fused together. Even though the spine has sort of limited movement, the big vertebrae down the spine, they're called gliding joints, do have quite a bit of movement. And what we have to understand is right here in the sacrum, there's no movement. It's all fused together. Underneath that are 2 to 4 little tiny vertebrae that are all fused together also, and this is known as the coccyx. Now, the coccyx is a very, very delicate place. If a student falls on their coccyx, you can see how small it is and how fragile it really is. And so we have to really pay attention to movements like kicks across the floor, big kicks across the floor, because if our students fall during one of those big kicks, they're going to fall right on that very, very delicate place. Let's go on with the skeleton from the anterior view. Now, up here, we have what's known as the pectoral girdle. It's everything about the shoulders. So let's name these bones. This bone up here on top, we know this as our collarbone, but the real name is the clavicle. And you can see that the collarbone comes around, and if we look at the posterior view, we'll see that the collarbone attaches to this angel wing, we call it a lot of times. But the real name of this bone here is the scapula. And how I remembered that when I was a student is I rhymed it with Dracula, and I thought, well, Dracula hangs his cape off of his shoulders. And so that's how I remembered it. Whenever I come across these little tricks, I'll let you in on them. So the scapula, rhymes with Dracula, is really the shoulder blade. When we come around, we see that right here, there's an articulation or a joint. It's the arm bone. And this is sometimes called the funny bone down here. And I remember funny bone, humerus. The name of this bone is the humerus. So right now, we really are talking about the appendicular skeleton because it's hanging off of our axial skeleton, right? This, the humerus, the scapula and the clavicle make up what's called the pectoral girdle. But we're going to go a little bit further down on the arm, and we'll come across to these 2 bones right here. Now, one is the ulna and one is the radius, and I'll tell you how I remember this, one of my silly ways to remember. Remember anatomical position? Mr. Bones is in anatomical position. And you'll see that right here, attaching to the thumb, right here, attaching to the thumb is a bone, and that's the radius. Now, how I remember that is, when I was a student, I thought, oh, how can I ever remember that? And I thought, well, when you hitchhike and you use your thumb, you're trying to catch a ride in a car, and when you get there, you can listen to the radio. That's how I remembered it. So the thumb part attaches to the radius. This bone here is called the ulna. Let's move down to the pelvis or the pelvic girdle. Now, right here you can see there's a big flat shaped bone, and on me, if I put my fingers right here, and I'm sure you can do the same thing, you can feel this bone. What we're actually feeling right here are these bones right here. This part of the pelvis, that curves around and makes this like heart shape is called the ilium of the pelvis. And right here, the very, very top is called the crest of the ilium. Down here in the back, let's turn this around. Down here in the back, we see the sit bones. Those little bones, when you sit down and rock back and forth, you can feel those bones right there. The real name is the ischium. So the pelvis is made up of the ischium, the ilium, and then we'll go back to the anterior view and come right in here, and we see the pubic symphysis. So these three bones, ilium, ischium, pubic symphysis, make up the pelvic girdle. I'm going to turn Mr. Bones to the side for a moment, and we're going to look right here in the hip socket. If I could take this hip out, this big long bone, which is the femur, if I could take it out, you would see a cavity or a cave in here where the bone attaches. The name of that cavity or that little cave is called the acetabulum. And as you can see, the femur, this very long bone, attaches inside the acetabulum. This big bone that goes inside is called the head of the femur. And then this little tiny place around the head is called the neck of the femur. Now these are very, very important places because this joint, as you know, is called on so much in dance, and so many ligaments and tendons are around this joint. As we go down, I want you to look at some very important places right here on the femur. This big knob right here to the side, we can sometimes feel it on our side of our hip, is called the greater trochanter of the femur. And on the inside here, we have the lesser trochanter. Now, many of the muscles that we're going to be talking about, the muscles that work the hip, attach to either the greater trochanter or the lesser trochanter. And this is what gives the hip a lot of mobility in this joint. Let's continue down the leg. We come on down the leg, and again, we know that this is called the femur. Right here is the kneecap. The real name is the patella. And if I turned our Mr. Bones sideways for a minute, you can see that during flexion of the knee, the patella, it's going to kind of float around it. It really doesn't attach. So the patella is another place of big concern for us as a dance teacher. Continuing on down the leg, this big bone, this bone is called the tibia. And on the outside here, this smaller bone is called the fibula. Now these are all the basic bones we're going to be talking about. There's one more little bone I want to show you. It's right here at the end of the sternum. If you can see this little tiny bone, it looks almost like an arrowhead here. This is called the xiphoid process of the sternum. And the reason that I really like to point that bone out to my students is that when we go to port de bras, now that they've seen this on the skeleton, I tell them I would really like to see your ring finger right in front of the xiphoid process of your sternum, and they know exactly where I want their arm placement. Now these are all the bones we're going to be talking about, just the basic bones, and now we're going to move on and talk about joints. Now let's talk about joints. There are lots of kinds of joints. The type we're going to be talking about are called synovial joints because there's a lot of movement around synovial joints. There are other types of joints too, like these joints up here in the top of our skull that are fibrous joints, but we won't be talking about those. We're going to stick to synovial joints. There are many types of synovial joints. I'm going to tell you about my favorite first. It's the ball and socket joint. Now, a really good example of a ball and socket joint is right here at the shoulder. And you can see the ball and socket joint in my arm has so much movement. Your arm too. There's a lot of movement in all directions with our ball and socket joint, especially in the shoulder. Another ball and socket joint is right here at the hip. And remember we talked about the acetabulum? We have the acetabulum, that little cave, and then the head of the femur. It goes right on in there to that acetabulum. So if this is the femur and this is the head, right in the middle, and you can see there's lots and lots of play there. So if we look at the joint one more time, we'll see that there's lots of movement in every direction. We can adduct, abduct, flex, and extend, and rotate both medially and laterally in this ball and socket joint and in this ball and socket joint. That's why I like ball and socket so much, because there's so much movement in the ball and socket. The next type of joint we'll talk about is the hinge joint, like we find here at the elbow. Hinge joints can always do flexion and extension. Now, there's not too much going on at the elbow in dance, but a hinge joint we really have to watch out for is the knee, which is a modified hinge joint. Now, down here at the knee, we see that it hinges, and there is a little tiny bit of medial rotation, but just a little tiny bit. In fact, there's so little that I like to just think of the knee as a hinge joint. And that way, I never let the knee go over the little toe or over the big toe. I just want my knee right in the middle of my foot, especially when doing pliés. So even though there is a little bit of medial rotation, and that's why we can do rond de jambe en l'air, we're always going to refer in this video to the knee as a hinge joint or a modified hinge joint. Another kind of joint is called an ellipsoidal joint. Now, with ellipsoidal joints, it would be something like your wrist, where it can hinge, it can go back and forth this way, but it can also go side to side this way. So we refer to that type of joint as ellipsoidal. Now remember we talked about the atlas and the axis up at the top of the cervical vertebrae? You can see that I can say no, and I can say yes. And so that type of joint up at the atlas and the axis is known as a pivot joint. The last type of joint we're going to talk about is the gliding joint. And many times the spine is the best example of the gliding joint. Now the gliding joint can go forward, it can go back, it can go laterally side to side, it can twist and rotate. So these joints, although they don't have a lot of movement like a ball and socket joint, there's still enough movement in the spine to consider it a synovial joint. And you see when dancers do the grand port de bras that they are really using all the directions of the spine as a gliding joint. Let's start out by talking about the properties of muscle. Muscle basically has 4 properties. It can stretch, it can contract, it's elastic, which means when it stretches, it'll go right back to its original shape if it's not overstretched. And the last property is it's irritable. Now what irritable means, all it means is that it reacts to electrical stimuli, which is great because that's what our nerves do, is they give electrical stimuli to our muscles, and that's why they will react. Now one thing that's important to know about ligaments, bones, and muscles is they all have very different properties. When we think about a muscle, we'll know that we attach the muscle to the bone through a tendon. Bone attaches to other bones through ligaments. Now, why is this important to know as dance teachers? It's important to know because we can change muscle, we can change tendons, but there's no changing ligaments. They're not going to stretch, they're just going to tear. So it's important to know because in areas such as the hip, the one we talked about here where the head of the femur attaches here into the acetabulum, there are a lot of ligaments, there are a lot of tendons, there are a lot of muscles in the area. So we have to know what we can change and what we can't change. So remember muscle, yes, it'll stretch, we can change it. Tendons stretches a little bit, so there's some play there. Ligaments, they're not going to change, so we don't want to push our students in an area where we know there's danger of tearing a ligament. So let's go on and name our muscles. We're going to start over here on this chart, and we'll start with the anterior view of the female. we can see a little bit of the muscles of the back coming around to the front, but we're going to talk about those when we look at the posterior view. Let's start out here in the front. You see this big green muscle right there? That is called the pectoral. The pectoral muscle actually has layers. What we're looking at on this chart is the major pec. Underneath there's a muscle kind of just like it, the minor. Now you can see that the pec really has a lot to do with the pectoral girdle that we talked about up here at the shoulders. The pecs come right across the chest, and they're a big muscle, a very important muscle for us dancers. On the side here of the shoulder, this yellow area right here, this muscle is called the deltoid. Now the deltoid is an extremely important muscle on dancers. Let's go over here and look at the skeleton again. The deltoid actually has 3 heads, and all 3 of those heads are very important to us. The deltoid comes off of the shoulder and attaches to the top of the humerus right here. There are 3 heads of that deltoid. So if we just look at my shoulder for a moment, we'll see it as a cap. There's a frontal deltoid, and that's called the anterior deltoid. We know that word anterior. There's the side deltoid, which we call the lateral deltoid. And then in the back, there's another cap of the deltoid, which, you guessed it, is the posterior head of the deltoid. So again, the deltoid is going to have 3 areas, and they all have a different job. As we move down the arm in front, you see this red muscle right here? That is the bicep. The bicep on me, you can see, is this frontal muscle here. And we all see biceps all the time on even the cartoons when everybody flexes their muscle and they have that big muscle at the bicep. Coming down the front of the body, we're going to talk about abdominals. Abdominals are so interesting and so important to us as dancers. There are actually 4 layers of abdominals. On this chart, we're not going to see all those layers, so let me tell you about them. The very most inside layer of the abdominals has fibers that cross like this. They're on the transverse plane. So if we look at our skeleton here, we can imagine a sheath of muscle way deep inside coming across like this. This is called the transverse abdominis, and it fills in this whole area from the rib cage down to the hips. On top of the transverse abdominis, which is a big sheath that goes all the way across, are the rectus abdominis muscles. Now these are very long muscles that travel down this way, and this rectus abdominis muscle gives us the look of that 6-pack we sometimes talk about. So if we look over on our muscle chart, you see this blue area here? This blue area represents that second layer, which is the rectus abdominis. And you can see how you can get a little 6-pack out of there by all those little sections. On top of the rectus abdominis is the 3rd layer. This is called the internal obliques. Now if we look back at our skeleton, this again is a big sheath that goes over the whole wall of the abdominals. And the fibers go up like this. So if I get behind here and I make the fibers, they're moving up this way. The name of this muscle is called the internal obliques. The very last sheath across, the 4th layer of the abdominals, is called the external obliques. And a lot of times when you're learning about external obliques, they say, these are the hands in your pockets. Like if I were putting my hands in my pockets, I would be going this way with my hands. So the external obliques are the hands in the pockets type of fiber. They move down this way. So let's look at our muscle chart again. And you'll see this little yellow area here, this golden area. See how the fibers are moving down? Hands in the pockets? Those represent the external obliques. Now, the abdominals have so many different jobs to do. Each layer has a different job. And when we get into talking about the the mechanics of the body and how the muscles act on the bones as levers. We're going to talk about all the jobs they do and what each one of those sections is assigned to do and how that's going to help us as dancers. But first we're just going to name all the muscles, all the basic muscles. So we come down to the hips. We're just talking about the anterior view here, and we see a very important muscle right here. You see this green muscle that travels across? That muscle is so important to dancers. It's called the sartorius. And if we look at my body, I'll just show you that it comes from the side of your hip bone all the way across to the knee. So if we look at the skeleton, let me show you. It starts right here. The start of a muscle is called the origin, so it originates right here. It comes crossways and attaches to the inside or the medial part of the femur here. That crosswise muscle, again, is called the sartorius. Let's go back to our muscle chart. We'll look at it one more time. There it is, coming across. The other muscles that we're going to talk about pretty much travel downward. You see these muscles? There are 4 of them, and together they're called the quadricep. Quadricep 4, quad 4. So those 4 muscles are called the quadricep, and they go all the way down the front of the leg. On the inside here, you see these muscles on the inside of the leg. They are referred to as the adductors. Now remember, we talked about adduction. Adduction, if we look, is we saw Amanda doing a tone do to the side, and she pulled her leg in, and that squeezing action, like riding a horse and holding on tight, are the adductor muscles working. So again, if we look over here at our skeleton, the adductors would be all on the inside or the medial part of the leg. Now, let's go from the knee to the ankle, and we're going to talk about one very important muscle. It's the muscle we see here that's a little bit blue. That is the tibialis muscle, and it's right in front of the tibia, so that's pretty easy to remember. It runs from the knee to the ankle. Now let's go through and name the muscles from the posterior or the back view. We're going to start right up here at the very top of the skull. And you'll see there's a muscle here in blue that comes down and makes half of a diamond. Well, you can see on this chart it's half muscle and half bone, but this muscle, it's very big and it does make the whole diamond shape. This is a very important muscle for us to know. It's called the trapezius. So if we look at the skeleton, we'll see that the trapezius starts way up here at the base of the skull. It fans down to the scapula, coming out, and then we complete our diamond as it comes in and covers the whole rib cage. So it goes all through the thoracic vertebrae. It makes that big diamond. Now, that muscle, the trapezius, has many jobs for dancers. We'll be going through all those, but let's remember the name, trapezius, very big muscle in the back. Right below the trapezius here, we can see the deltoid again. Remember I said there are 3 heads of the deltoid? Right here we can see the lateral head of the deltoid on the side, and right here the posterior part of the deltoid. The deltoid is majorly important for all movement of the arm. This purple muscle right here, the muscle we see in purple, the name of that muscle is the latissimus dorsi. Sometimes it's pronounced latissimus dorsi, but I'll say latissimus dorsi. Oftentimes it's just referred to as the lats. Very important muscle for us. Now, on the back of the arm here, this little muscle that's deep purple, that muscle is the tricep. Now, let's look at my arm for a minute, because we remember that we saw the bicep in the front. Well, the tricep is its counterpart right here in the back. So we have the bicep in the front and the tricep in the back. Moving down the body, we're going to talk about the muscle that is the most important, I think, to train correctly in the hips, and that is, you guessed it, the gluteus maximus. Now right here we see the gluteus maximus with the fibers coming across. It's the muscle here that's green. The fibers come across downwardly. Now, right behind the gluteus maximus is another muscle that's extremely important for us, and that is the gluteus medius. A little bit hard to see here, but you can see right behind is the gluteus medius. Now, these muscle fibers go more straight down. So the gluteus medius is right underneath the maximus. So if we have some fibers going this way, other fibers go this way. And those two muscles, the maximus and the medius glute, they have very specific jobs that we need for our turnout and our add and abduction and our medial and lateral rotation. So these are very, very important muscles to know and to know what jobs they do, which we'll be getting to. In the back of the leg, coming down, there are many, many muscles here, but they are, as a group, referred to as the hamstrings. Underneath the hamstrings, we see the calf muscle. The calf muscle actually has two parts. The first part here up on top that we see as green is called the gastrocnemius. And if you look underneath, there's another muscle. It's a little bit purple on this chart, and the name of that muscle is the soleus. So the calf muscle is actually made up of two muscles, the gastrocnemius and the soleus, and they each have different functions for the calf. So it's very important for us to know that. Another muscle that's very important to us is the serratus anterior. The serratus anterior comes from our backs and wraps around this way. So on this chart, on the anterior view, if you see this little blue area right here, on top of that abdominis, that muscle right there is part of the serratus anterior. So if we look on the skeleton, turn him around, the serratus anterior comes across the body this way and attaches in here at the ribs. Now, this is a very important muscle for us to identify on our students, and even though sometimes in muscle charts it's a little bit hidden, we've really got to pay attention to that serratus anterior. There's a group of muscle that is so deep that sometimes it's hard to see on a muscle chart. So I'm going to show you a little illustration out of this textbook. This group of muscle is known as the iliopsoas. The iliopsoas is very, very important to us as dancers, as we're going to see. So we really need to know all about it. You can see that the iliopsoas starts at the lumbar vertebrae and it comes down and attaches to the lesser trochanter. This muscle, these long muscles here, those are the psoas muscles, and on the inside of the pelvis is the iliacus. Now these together make up what we call the iliopsoas. So let's look on the skeleton at where those muscles actually do originate and insert. The psoas muscles, remember those 5 lumbar vertebrae? The psoas muscle attaches to each one of those vertebrae 1 through 5, it comes down in front of the pelvis and attaches here at the lesser trochanter on the inside of the leg. That is the psoas. Now the iliacus, it starts at the crest here of the ilium and comes down and also attaches here at the lesser trochanter. Now at the side here of the crest of the ilium, there's a muscle called the tensor fasciae lata that we really want to know about. It's just a muscle that goes from here to here. So it originates here at the ilium and it comes down and attaches to the greater trochanter. In this diagram, we see long muscles that come down the spine, all the way down the spine. And if we look at our skeleton, we can see that they would start up here at the top of the skull and travel all the way down the spine. This group of muscles is known as the erector spinae. Remember I said at the beginning of the portion where we started talking about muscle, that muscle, one of the properties is that it's irritable. Now remember what that means? It means it responds to electrical stimuli. And where does that electrical stimuli come from? Well, it comes from the nerves. Where do the nerves come from? Well, let's look at the spine here. You can see on Mr. Bones here that there are lots of little yellow pokey things coming out of the spine. And what this represents is where the nerves come out of the spine. And those nerves travel all throughout the body, and these are the nerves that give the muscle the message, the electrical impulse that makes them contract or release. Now that we know all of these major muscles and where they are and what their names are, we're going to go through the bones and the muscles again with Amanda demonstrating, and we'll talk about what each of those muscles do in the body that are so important for us when we're teaching technique. Now we're ready to talk about the dancer's body and how it moves, why it moves, and how we want it to move. And particularly, we want to talk about injury prevention because we don't want it to move how it doesn't want to move. So we're going to talk about each joint, each articulation, what muscles are in charge of that, and how it all works. The first thing we're going to talk about, though, is another name for muscles. So let's go sideways, Amanda, and let's give us your arm this way one more time. Make a muscle. We all know this is called the bicep, right? And the underneath part is called the tricep. Now come back out again, Amanda. If you can imagine when Amanda bends her arm, the bicep is getting shorter. At the same time, do it for me again, Amanda. At the same time, the tricep is getting longer. Another name for the prime mover, that's the prime muscle that's moving her arm this way. Another name for prime mover is agonist. The muscle on the other side of the prime mover is called the antagonist. Now, why do we even want to know this? Well, here's the reason. As dancers, we are constantly shifting our body around and changing agonist and antagonist jobs. And it is the tension and the relationship between the agonist and the antagonist that shifts dance through smoothly and gracefully instead of just jerking it around and looking like spaghetti flying through thin air. We really want to prime that relationship between the agonist and the antagonist. The other reason is no muscle group ever works alone. You might see, let's stand front a minute, Amanda. You might see at the gym, people who work the front of their arms like this. Like, let's say Amanda goes to the gym and she just looks in the mirror. She's doing bicep curls all the time at the gym. This part of her body would start getting very short and contracted. At the gym, when we see those real muscly guys that are kind of hunched over forward and standing like this, we call that mirror syndrome because they stand in the mirror and they look at their body and they work on the agonist and they never give any time to the antagonist on the other side, so everything becomes very drawn in. As dancers, we always want to remember and work on both sides of any joint and any movement, working not only the agonist in our mind, but remembering what the antagonist is also doing. So now with Amanda, what we're going to do is I'm going to run through each joint on the dancer's body or anybody's body, and we're going to talk about which muscle is the prime mover or the agonist. We're going to start with the shoulder. Now go to the side for me again, Amanda. Just put your arm up this way. This movement of the arm coming up, we remember as shoulder flexion. Remember that? No. Bringing your arm down. What muscle is in charge of shoulder flexion? Remember I talked about the 3 heads of the deltoid here? Whenever the arm goes forward into flexion, the prime mover is the front of the deltoid here and the pectoral muscle. So shoulder flexion is pectoral muscles here, the anterior head of the deltoid. When Amanda goes to the side, let's just go a la second. So your arm goes a la second. This, remember, we called abduction. The muscle in charge of abduction is right here, the lateral head of the deltoid. Now remember when we did shoulder extension, the shoulder coming back? The prime mover in shoulder extension is, you guessed it, the posterior head of the deltoid. Now, the deltoid is a pretty strong muscle, and sometimes it's overtrained without thinking about the rest of the shoulder and the back. Let's just review the posterior view for just one moment, because remember, we have that big diamond-shaped muscle here, the trapezius, and we also have the muscle coming across back here, that big muscle, the latissimus dorsi. Now, in dance, we want the shoulder always to be very stabilized when we want it stabilized and mobile when we want it mobile. And we've got to call on all of these muscles at the same time, because some are going to stabilize and some are going to be mobile. As dance teachers, it really behooves us to know in each one of those directions that we talked about, what is the prime mover? So I'm going to ask Amanda to go into en bas position. In port de bras, our students oftentimes have a little trouble making it look graceful. So just come down and hang your arms, Amanda. When students just hang their arms like this and they don't have any shape to it, we know they're not using their back muscle, the latissimus dorsi, because the latissimus dorsi is in charge of medial rotation of the arm. So when we put a little air under the armpit and we bring the elbows forward, we're in medial rotation. The muscle in charge of medial rotation again, it is latissimus dorsi. As Amanda goes up into middle fifth, we know that this is shoulder flexion. And remember, the muscle in charge of shoulder flexion is the pectorals in the front and that very front part, the anterior deltoid. As Amanda is going to open into a la Sacrum, remember this plane here? That was the transverse plane. She is doing transverse abduction. So do that again, Amanda. Let's look at that again. Abduction goes away from the midline, transverse abduction. The muscles in charge of transverse abduction are the anterior deltoid, the very back of the deltoid, and a little bit of the trapezius. So turn around for me for a minute, Amanda. We're going to talk about the trapezius again. Remember, that was that big muscle that made the diamond? Well, the trapezius is actually divided into three parts. There's the upper, there's the middle, and the lower, and each part has its own job. So let's turn around and face the front again. When the dancer comes from en bas up to a la Sacrum position, the arm moved away from the body. Let's try one more time from en bas. Remember what this is called? It's just plain old abduction. When the dancer puts their arms back, that would be adduction. So what muscles are in charge of ab and adduction? Shoulder abduction, the muscle in charge, is the lateral head of the deltoid. But when we just are using the lateral head of the deltoid, we could be standing with the chicken arm like this. It doesn't matter, because anything that lifts the arm is going to be the deltoid doing it. But as dancers, we want it to look a little nicer than that, because even, like, do this icky arm, Amanda. Even that is the deltoid. So how do we get the arm to look nice? We're going to use a little bit of medial rotation here, which comes from the latissimus dorsi. And we also need to stretch through the tricep and lift the elbow a tiny bit so that we have a nice rounded arm. That takes a lot of training. Let's come on down, Amanda. So we've gone through our port de bras. Let's go through. We have flexion of the shoulder, which is the pec and anterior. As we open into transverse abduction, we know that that's the posterior deltoid. Coming back down, we have adduction, and we know that adduction, the coming down, is the latissimus dorsi. Let's move down the arm a little bit to the elbow. We've already done this a little bit, and come on out. This would be elbow flexion. The muscle in charge of flexion here is, of course, the bicep. Extension of the elbow is the tricep. So again, let's go to en bas position, Amanda. When we are going through all of our port de bras, let's talk about the muscles we're going to use. So just follow me, Amanda. We're using the pecs and the deltoid. We're using the deltoid. We're using latissimus dorsi. Now, what exercise can we add to our warm-up, do you think, that would exercise all of those muscles? You know what's the greatest one? The push-up. You can see here in the push-up that Amanda is executing elbow flexion, elbow extension, and shoulder flexion and extension. Therefore, she's working her pecs, her bicep, and her tricep. Now remember when we looked at the back and we looked at those angel wings, the scapula or shoulder blade, and we talked about elevation. Let's go into elevation, Amanda. Elevation, depression, inward retraction, and protraction as it comes apart. These are very important concepts for us as dancers because this is going to stabilize the spine and it's going to put our shoulders and our back right in the place where we want it for proper alignment. So let's talk about which muscles work each one of those movements. Elevation is worked by the top of the trapezius. Remember we talked about the trapezius having 3 parts? Depression, pushing down the shoulders as hard as you can, is also the trapezius. Retraction coming in, guess what? It's also the trapezius. But here's the one we want, protraction, where the back widens. Stand to the side a little tiny bit, Amanda, and go into a la seconde. Remember that one muscle group we talked about, the serratus anterior? In protraction, the serratus anterior pulls the scapula apart from each other as the muscle wraps around this way. Now when we stand at the bar or in center floor or when we're performing, anyway, we stand that we want proper alignment. We never want to see retraction. Do retraction for us, Amanda? Never. It throws the rib cage off and it really messes up our alignment. What we want is protraction, not too much medial rotation here. We want to be standing up straight, but we've really got to practice with our students the protraction of the shoulder blades. What we want to do is use the muscles in the back and the muscles in the front to stabilize our students in this whole torso area so that they're very stable throughout their movement. Now, those 4 abdominal muscles, let's talk about those and what jobs they have. On the very, very, very inside, remember we said we had the transverse abdominis, the fibers go this way. The transverse abdominis has one job, and that job is compression. Now, a lot of times we think as dance teachers, oh, we have to build up the abdominals in our students so that they can have stabilization. And so we have them doing crunches. But really, crunches have nothing to do with that stabilization. The stabilization comes from that innermost layer, the transverse abdominis. The transverse abdominis is only concerned with compression, and there is no exercise for compression except compression. So if you take all the air in your body and force an exhalation, you'll feel it compressing. That is the transverse abdominis. Now when we are with our students, especially at the bar or standing center floor, we're talking about alignment. Compression is a huge part of alignment and stabilization of this area. So when we see our students standing what I call the bean body, they're pressed like this, usually there's no compression going on at all. It's just everything hanging out. But if we put our pelvis into place and then take the compression in the abdominals and they compress and lift, I call that the internal girdle. It just presses in and you hold it in place by compressing. Again, there's no exercise for that except compression. The next layer we talked about, remember it's the 6-pack? The next layer is the rectus abdominis, those really long muscles that go from the pubic bone all the way up to the sternum. That muscle, the rectus abdominis, is in charge of flexing the spine. Flexion of the spine is when the spine curls over forward this way and come back on up. It was the abdominals doing that flexion. And when we go into cumbre, that is called extension of the spine. So come back up, Amanda. The extension of the spine, the prime mover in extension of the spine is the erector spinae. So one more time. Flexion of the spine moves it forward, and the prime mover is the abdominals. And extension of the spine that we see in cumbrae is the erector spinae. Now let's move into the hip area and talk about the muscles that are in charge of moving all those bones around the hips. Come into a parallel passe for me, Amanda. You can see here that Amanda is in hip flexion. The muscle in charge of hip flexion is the iliopsoas. Okay, come on down, Amanda. Remember we talked about the iliopsoas? It starts at the lumbar vertebrae back here. It comes all the way through the pelvis and attaches on the inside of the leg at the lesser trochanter. So the iliopsoas, that group of muscles, is incredibly important for us to train and know about because it's in charge of all hip flexion. Now the opposite movement of hip flexion, of course, is hip extension. So we'll go back for a moment and go into your tondu to the front, Amanda, with this leg. We've got a little bit of hip flexion going here, and now tondu to the back. Moving in this direction, what is the muscle that has taken her leg back into extension? It's the gluteus maximus. And come right back into your first position. The gluteus maximus has another very big job. Let's face the front. The very big job is tondu to the front and parallel. Parallel for me in tondu. Right now we don't have any rotation going on, but if Amanda turns out and goes into lateral rotation, the muscle in charge of lateral rotation is also the gluteus maximus. Now go inward, medial rotation. Remember we talked about the muscle underneath the gluteus maximus, which was the gluteus medius. When you turn in medial rotation, we are using the prime mover, the medius, gluteus medius. So let's turn out one more time and come in. So we can see as Amanda does her tondu to the back, she is rotating and she is extending the hip. Both of these movements call on the gluteus maximus. Very, very important muscle for us. So come back in, Amanda. There are actually 6 deep, very deep rotators underneath the maximus, but the prime mover of lateral rotation or turnout is the gluteus maximus. Not the knee, not the ankle, as so many dancers like to push it at the bar. It is only in the glutes, gluteus maximus and deep rotators underneath. Now let's stand forward and go into tondu alla second. When we have tondu alla second, you can see that Amanda is executing hip abduction. Remember, it goes away from the body. Hip abduction is all about the gluteus medius as well. So turn in your leg now. Lateral rotation is the gluteus maximus. Medial rotation was also the medius. So come on back in, Amanda. As she comes back in, what was she using to come in? The adductors of the thigh. So one more time. Let's go out. That is abduction, gluteus medius, and come back in. Adductors of the thigh are in charge of that motion. So you can see when we're doing tondu or we're doing dégagé that your body's just switching back and forth. Abduction, adduction, abduction, adduction. So we're going from the rotators in the glutes and the gluteus medius to the inside of the thigh, which is the adductors. Now, do a couple tondus for me, Amanda. This leg is the performing leg. But the leg that is really working so hard is the standing leg over here. And this leg is executing stabilization. Now what is stabilizing this leg? You guessed it. It's that gluteus maximus. So the more rotation we have, the more tight wrap around in the hip, the more stable it's going to become. Also, as she does that, she's got the abdominals stabilizing her in the front, she's got the erector spinae stabilizing her in the back, she's got the lats stabilizing, she's got the scapula pressed down and protracted with the latissimus dorsi stabilizing, and here up, remember that great big diamond, That great big trapezius muscle is performing depression. So her body is very stabilized, which lets her ball and socket joint, remember that head of the femur inside the acetabulum? It has lots of movement in there. Now, as she goes in and out of this ball and socket joint, there is fluid building up in that joint, letting it move more and more easily. It kind of greases it up. That fluid is called synovial fluid, and that's why when we're dancing and warming up, it's so important to warm up on all of those planes: lateral, sagittal, transverse, medial rotation, lateral rotation, because when we move like that, that oil, it's like a DW40 almost for the joints. That synovial fluid starts building up in the joints and lets our range of motion increase. So that's what's very important about your warm-up, is to have each one of these. Now let's go on. We've done adduction of the hip, we've done abduction of the hip, we've done lateral and medial rotation, we've done extension, and we've done flexion. You can imagine an arabesque. It's like super extension of the hip. And when we bottom out to the front, it's like super duper flexion of the hip. But we have to think of more than just the hip. Let's stand sideways and go to second position, Amanda. So you're going to plie in second. If you look at her from the side, right here, the placement of the pelvis is so very important. If Amanda tucks her pelvis under, go ahead and tuck under, and now plie. So many students do that tuck as they plie. What it does is it takes the flexibility out of the spine so it can't ever absorb shock anymore. So it's particularly dangerous to train this way. So what we want to do is not have our students be in bean body position, go to bean body, which is total extension of the spine. We want their abdominals to lift them up and compress them into place. We want the erector spinae lifting the spine so you're not a hunchback. We don't want the hips backwards. We don't want the hips forward. If you think of the hips as a bowl of soup, we want all the soup to stay in the bowl. Now, in order to execute a grand plie or a demi-plie from here, it's all about rotation in the hips. Because from the pubic bone to the top of the head, it's just going to stay one long line. Not only that, it's going to stay one long, stable, and compressed line. So when we go into plie, what we're really doing, go ahead, Amanda, what we're really doing is thinking all about rotation in the hips and push down, and we're thinking about compression in the abdominals. Let's go down and look at the knee. So we're going to see what muscles are in charge of knee flexion and knee extension. Can you go all a second with your arms? Amanda, I'm going to ask you to go to a coupe, a parallel coupe. So we have a little bit of hip flexion going on here, but we're really looking at the knee. When she stretches her leg out long, that is extension of the knee. The muscle in charge, you can see it so hard and popping out on her, is the quadricep. And come back to your coupe. Now, when you bend the knee back, we have knee flexion. And the muscle in charge of knee flexion is the group of muscles here known as the hamstring. There are two actions that go on at the ankle that we want to talk about. Now, in dance, when we point our foot out, we call that extension. And when we flex our foot, we call that flexion. But in the wonderful world of kinesiology, they don't call anything extension. They call them both flexion. So when Amanda goes up into her releve, that is called plantar flexion. Plantar flexion, you can see what's contracting is the calf. So the prime mover of plantar flexion is the calf muscle. Okay, come on down, Amanda, and tone it to the front parallel. When she goes into flex on that front foot, just flex your front foot, that's called dorsiflexion. And you can imagine the muscle that's contracting is this muscle right here. So the prime mover is the tibialis muscle. Now that we have all of this valuable information, what are we going to do with it? Well, what we're going to do with it is be able to apply it to training our students, because we are going to know the prime movers, which muscles are moving your body for each exercise that we go through. So when we see something like an arabesque, for instance, and we go, oh, that just doesn't look right. Pull here, pull there. We're not going to approach training our dancers that way anymore. We're going to look at that arabesque and go, I can see that the rotation is not right here. I can see that the knee is bent there. I can see that the erector spinae isn't pulling up the spine correctly. We're going to be able to see the problems, analyze them, and then repair the problems from a very scientific point of view. So when I was making this videotape, I thought I could do that all in 90 minutes. But I can't, because we're almost done with our 90-minute video. So look for the follow-up video, and in that video we will go through many, many exercises and positions such as the battement, the arabesque, turns across the floor. We'll approach all of these movements, these common movements and positions that we see in dance. We'll analyze them. We'll see which muscles really should be working, which ones really shouldn't be working, and we'll fix all of those problems from this anatomical and the kinesiology point of view. Also in the next video, we'll go into applying our knowledge in injury prevention. Now, you know in dance as well as I do that the exercises that we do them over and over and over again, pliés, tendus. We do them there's so much repetition in our exercise. And if our students are doing them incorrectly in any way, they're doing something that's going to be giving them chronic injuries in the future, maybe giving them a very short career in dance. So we want to catch that before it becomes chronic. And with our new knowledge, we will be able to do that. Now, I don't want to leave you quite yet. We're going to do just a little bit of that in this video. In the next video, like I said, will be injury prevention, we'll be analyzing the movement, and we will also be going through exercises that help us get the results that we want. But first, let's just take a little look at a few of these problems and how we can fix them. Now, one of the most common problems we see, especially in ballet at the beginning of the class, we see our dancers come in and they take their place at the bar and then they prepare to turn out. Now, this is what we see a lot of dancers do that's incorrect, and we want to nip this one in the bud. They come in and they start turning out their feet with their knees bent. And then when they get their feet as turned out as they can, they straighten their legs. Now, let's talk about why this is a problem. Come back to parallel, Amanda. What we know about rotation is rotation does not happen at the knee joint. Rotation does not happen at the ankle joint. Rotation of the hip happens only in the back here at the gluteus maximus and the 6 deep rotators behind it. So what I suggest is that you have your students take their leg out into parallel without moving the iliac crest here. They turn out as much as they can and bring the leg in. Then the other side. They take their leg out in parallel, turn out from the glutes, and bring their leg in. This way, you know that your students are rotating only from the gluteus maximus and the rotators behind it. But let's fix another little problem. Let's say Amanda's going to do that. Let's look at the abdominals, because we know that we need to compress the abdominals at the same time. So the best thing to do is to first talk about the pelvis. Remember, we said the pelvis is a bowl. You don't want the soup to spill out the front. You don't want the soup to spill out the back. So how are you going to keep the soup from spilling? Compression. Compression of the abdominals. So the first thing I want you to do before you rotate, Amanda, is compress the abdominals. You'll feel it in the lower abdominals right above the pubic bone. Now that she's compressed, I'm going to ask her to pull down in the back, so her sit bones pull down in the back, pull up in the front. We've got compression going on hard. Now let's do your rotation. She's taking her leg to the front, rotating only from the hip socket and bringing it in. Other side, I want you to only think about rotating from the gluteus maximus and bringing it in. Now, if we go down and look at Amanda's feet, we will see if she does it this way, that the baby toe will be on the floor just as firmly as the big toe. And if you face the camera, Amanda, for a moment, and turn out using the glutes, you'll always see the arch. When you are overly turned out, your weight will go on the big toe, the baby toe will come off the floor, and this little arch here will start to smash into the floor. So when we see this, we know that our students are trying to turn out from the ankle or from the knee. The knee is a hinge joint. It's not going to turn out like a ball and socket joint. So that's one of the ways we can make sure our students are going to be safe and also learn how to use their rotation from the correct place. Let's analyze another one of our movements. We're going to analyze this développé, try to figure out what's wrong with it, and then we'll fix it. So I'm going to ask Amanda to always start with compression. She comes up into her passe, everything's going along fine. Now Amanda, I'd like you to développé badly. Okay? As she développés, you can see she's leaning back a little bit. She's exaggerating, but this is a common problem. And we also see the knee bending right here. So come back to first position. So as her teacher, I go, what's wrong with that développé Amanda's doing? Well, first of all, she has shifted her weight back and not kept it on the ball of her standing leg. Why would she shift her weight back and not keep it on the ball of her standing leg? Well, the reason is she's bending her knee. Well, how do you fix a bent knee? Well, we know that leg extension, knee extension comes from the quadricep. So as her teacher, I'm going to tell her, Amanda, I want you to do it one more time. I don't care about the height of your développé. What I want you to do is stay on the ball of your standing leg, pull up in the quadricep so that that leg stays very, very straight. So here she's coming. She's coming up to her passe. You don't have to take it that high, Amanda, but I want you to stay on the ball of your foot and pull up in your standing leg quad. A little more up in your standing leg quad so that the leg becomes very, very straight. Now I can feel here that her quad is as hard as a rock, and I know she's working hard. So come back to your tendu and in. Let's fix one more movement. We'll take the port-de-bras from en bas all the way up to fifth position. Now, when we have our beginning students, we see them looking like this in their port-de-bras, and we're thinking, well, it just doesn't look right. Now, why doesn't it look right? The reason it doesn't look right, let's come on down, is usually our beginning students in the first place aren't employing compression. So I want you to really get your compression going on in your abs so that the ribs are not going to stick out when the arms go up. So here we go. We're going to go all the way up into your port-de-bras. She's compressing, 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 but still when she gets to the top it looks rather droopy and pedestrian. Why does it look so pedestrian? Come on back. So I'm thinking as your teacher, well, let's see. This is shoulder flexion, and that's the pectoral muscle. That seems to be working fine, but what's happening on the other side of the body? What's happening on the other side of the body is that I don't have any depression going on in the scapula. And so when she comes up, it's all lifted up here like this. The pec's doing its job, but for a dancer, this just isn't a good look. We want to see a very, very, very long neck. How are we going to see that long neck? Depression of the scapula. And what muscle is in charge of depression of the scapula? We know it's the trapezius. So, as my student, Amanda's already seen my muscle charts, and so I can talk to her, and in her mind's eye, I can put this idea. Amanda, when you're going up, I want you to compress. You're doing that very nicely. You're bringing your arms up with your pecs very nicely too. But what's not happening is what's going on the other side of the body. Remember we talked about that whole agonist-antagonist thing? So I want you to think about pushing your arms down as hard as you can from your shoulders. Push down. Now just like a children's seesaw, let's say I have a children's seesaw and something's pushing down on this side and it makes this side come up. As you push down in the back, I want that to raise your arms. Go on, push down, push down, push down, push down. You get that feeling? Okay, good. This time we'll do it with shoulder flexion, so you'll be coming up this way. So you're going to flex in the pecs. The anterior deltoid is going to be working. That's a no-brainer. It just happens. But the thing that has to be different, that gives it the quality that we want, is what's going on the backside, the depression of the scapula. So push down, and let that start lifting your arms up. Compress the abdominals. More down, extend the tricep and the bicep just a tiny bit, and that's how we get that very long, lovely look in the neck. In the next video, we'll be analyzing lots of movements that we see in dance, very commonplace movements such as the arabesque, the battement, port de bras. We'll just be doing it all. We'll be analyzing, we'll be fixing those problems, and we'll also be going through exercises that can specifically work on those problems. Now, this tape and the next tape are mostly for us as teachers to learn about anatomy and kinesiology. But it's very important for us to put these muscles, what they look like and what they do, into the mind's eye of our student, so that when we ask them to use the gluteus maximus, for instance, they know right where it is, they know what the muscle looks like, and they know where it lies in the hip and what its job is. So even just with this video for starters, we can start educating not only ourselves, but our students, so that they know all of the basic bones, all of the basic joints, what kind of joints they are, and what kind of muscles attach to each lever in order to get the movement that we're looking for. The quality of the movement our dancers do so much depends upon their knowledge, their understanding of things like the agonist and the antagonist. Even though dance so often just concentrates on the aesthetic, learning about the scientific aspect of dance can really enhance not only the education, but the performance of our students and the performance that they give their audiences.